Good evening, folks. Welcome again, live from very hot and balmy London. I'm Dr. Will Nutland. I'm the co-founder of Prepster and the Love Tank. I'm joined tonight by Dr. It's important we say Dr. Matteo. Matteo, would you love to introduce yourself?
Hi, Will. Thank you. You're a great host, by the way. Yes, I am Dr. Matteo Prohaska. I'm a consultant scientist working with the UK Health Security Agency, and I'm part of the Sexual Health Liaison Group in the response for the monkeypox outbreak. And I'm here to provide updates and talk to you and try to answer some questions.
It's really nice to have you here. Matteo and I were here about a fortnight ago with the first monkeypox live community panel. We're really delighted to be here with you again tonight. If you are unable to stay for all of tonight's session, please be reassured that you will be able to watch a recording of this both on the Preps from the Love Tank's Facebook page and on the Love Tank's YouTube channel. Hi if you're in either of those places tonight. And although we are beaming in from London and most of the conversation tonight will be UK focused, we know that there are people who will be joining us from other parts of the world. Welcome, it's great to have you here. And if we talk about services, phone numbers, websites from the UK, and you're not from the UK and you are hosting some of these websites, please add them into the chat either on Facebook or YouTube. We will do a shout out to them. I know last time we were really fortunate to have some great links from some of our sibling organizations in the USA. We want to make a reminder to you that this is a publicly accessible forum. Please be aware that any comments you make can be seen and shared, including by the media. And at this point, we want to also say that we know that excerpts from last week or the last webinar that we did were used by a number of journalists to report on things that Matteo and I may or absolutely did not say. If you're joining tonight because a journalist has reported on something that they allege we have said, we do invite you to watch the whole of the recording to get the full picture and not just something that a journalist has decided to take a nice tasty portion of a sub-sentence that I've said and make claims that I did not make. So please carry on listening all the way through. We also ask you to please be kind and respectful. I will knock you, or one of my colleagues will knock you right out of the webinar if you're being nasty, racist, misogynist, transphobic, homophobic, or all the other things that are disrespectful. This isn't space for conspiracy theories, as we said last time. So if you're here to discuss Bill Gates or 5G, there's loads of other spaces where you can go and find about all of those things. This is not the space tonight where we really want to talk to you about those kinds of things. We're going to be putting up information links as we go through tonight, including a website that my organization has put up. So if you want to go and get good information about monkeypox, queerhealth.info/monkeypox is there. Our friends over at Terence Higgins Trust have their own monkeypox page. And then Matteo and some of his colleagues have a great set of ongoing updates from UK or England government departments on what's going on with monkeypox. So we want to acknowledge that this is a rapidly changing situation. It's important to keep up to date with using recent and good and reliable sources of information, some of which I've just put up on the screen there. And before we go on any further, I know Matteo and I would also like to acknowledge and salute again the work being done by Outbreak teams, public-facing health staff. Big shout out to our colleagues at the British Association for Sexual Health and HIV, who are doing an absolutely sterling job out on the front lines, making sure that many of us are safe and well, not just around monkeypox, but around HIV and STI testing, providing PrEP. We know this is such a busy time for you all and really, really want to thank you for all of the work you've done, including those of you who worked across the Jubilee weekend, because I know that there were some of you who were working very, very hard on that. We want to also thank lab staff, and people in other places like our colleagues at the World Health Organization, European Centre for Disease Control, all of those people who right now are working on the front line of this emerging public health outbreak situation. So Matteo, I'm going to pull you right in. And so there's been lots of information changing, lots of updates since we last spoke. And tell us what's changed in the UK. What should anyone listening in now need to know about?
I think the best way to start answering this question is to add in to your very exhaustive list of people you're thanking, because we really want to thank people that are coming forward for testing, for symptoms, and who are going to sexual health services. They're calling NHS 111 to make sure that they are screened, assessed, and then they undergo the pathway that allows us to diagnose and control this infectious disease. I think this is very much the kind of outbreak that needs community participation and engagement, which is why we're doing this forum. As you say, a lot has changed. We currently have over 320 confirmed cases of monkeypox in the UK, most of which are in England, most of which are in London, most of which are going to be in gay and bisexual men or other men who have sex with men across the UK. And I think the patterns that we were seeing in transmission a couple of weeks back hold, in the sense that we're still seeing this infection being transmitted in sexual networks of gay and bisexual men. But maybe we know a few things more about how, in which networks or in which settings it might be transmitted. And we have definitely done some steps to respond to the outbreak.
Thank you. And what I should have also said at the very start, and Miguel, thank you for already putting 2 comments in there, is that if you'd like to comment, if you'd like to ask questions, if you'd like to join the conversation, we would love to hear from you, and we will start addressing some of those comments as we go through and make sure there's time at the end to answer as many as possible. So Matteo, about 300 diagnosed cases in total, most of them England, most of them London, most of them gay and bisexual men. And I know from being on a European Centre for Disease Control meeting yesterday and a World Health Organization meeting the day before, I know lots of us are doing back-to-back meetings, that there are about 1,000 cases now diagnosed worldwide, mostly in areas that we've not usually seen monkeypox. And England, the UK, is making up kind of quite close to about a third of those cases. So when we see these numbers increase, is this because we have really good case findings? Is that because we have people on the ground who are asking those people who are coming forward, being diagnosed, and then we're asking them to provide details of people they've been close contact with? So are the numbers going up because we're doing good case findings, or are numbers going up because we're finding new infections, or is it a bit of both?
That's a really good question. I think it's a mix of things. To explain things further, this is very much a multi-country, multi-region outbreak, not just in Europe. There's also cases in the US, but we know this is connected to previous outbreaks that have been documented in Africa. And there's specifically in Nigeria, for example, there's been ongoing outbreaks that have been investigated for a few years. So there's knowledge that has occurred prior to this outbreak. And at the end, similar to what has happened with COVID before, we know everything. The world is connected. We're all interconnected in networks of human closeness and behavior. In this specific outbreak, we're seeing it transmitted in sexual networks of gay and bisexual men. And we know these networks are very international, very interconnected. There might be relationships sometimes with pride events, with festivals, with sex on premises venues. And that's very much what we're seeing when we talk to colleagues in other countries in Europe. In Portugal, many of the infections have been described being tied to Lisbon, in Spain to Madrid, in London, in England or the UK to London. So it's mostly because of these cities and the way people travel between these cities that the infection is being spread. It's true that London is a very global city, it's a very cosmopolitan city, and you have a lot of people traveling, coming and going. And that has been documented as one of the reasons why London is usually one of the signposts for some outbreaks in the past. For this specific outbreak, though, it is true that we're doing a lot of case finding. We're doing a lot of requests for people to come forward to sexual health services. And because of the strong links that gay and bisexual men have with sexual health services in England in general, we are seeing cases coming forward and being tested. So it's a mix of both. It's a mix of transmission because London has that nature, but also because we have the systems that allow people to be diagnosed.
And, you know, I often say this to colleagues around the world and colleagues in the UK, but I do think that the UK has one of the best NHS open access sexual health services that I see around the world. And I know that I keep talking about how it's hugely underfunded and needs massive investment. And despite that, we still do have a really, really good service. I don't know of anywhere else I've been to in the world where I could just kind of pick up the phone and walk in and access all of those services for no cost. And I think that in part also helps to explain why people are coming forward, because we are so used to having trusted, generally welcoming and good sexual health services, but also why we are also finding some of those cases, as you say. That's not to say we couldn't have more investment. I think I'm definitely allowed to be the one on this call that can push for that. So, Matteo, let's talk about transmission and whether we've seen any changes in this. So, until a month ago, when we talked about monkeypox cases globally, there was a lot of talk about people, particularly in parts of Central and West Africa, where kind of the monkeypox was generally thought to be most prevalent until a month ago. That people were monkeypox was transmitted usually through close household contact, often or possibly through things like bedding, through maybe shared towels, kind of generally through close household contact. And that was what was surprising to all of us when we started to see these kind of early cases 3 or 4 weeks ago. And there's very early cases in London. And now, as we talked about 2 weeks ago, we're thinking that monkeypox in these European outbreaks are being transmitted less through household contact, but more through close physical contact. And I know there's been lots of discussions in some of the meetings that we've been at and some of the international and European meetings about how we primarily think that monkeypox is being transmitted right now. And when we talked a fortnight ago, we were talking about close contact, as in often close physical contact during sex, maybe when guys were going to a club and dancing up close with the tops off against someone, so rubbing up or having a bit of a bit of frottage. Do we know anything more from when we last met 2 weeks ago about what we think might now be the main routes of transmission?
I think it's so important that we remain humble about what we know and what we don't know, because this is a fast-moving situation. And prior to this outbreak, there was only a handful of cases that had been thoroughly studied, and there were a lot of assumptions about how this is transmitted. A few weeks back, we talked, and I remember we were talking about how sex is one of the most popular forms of close contact, of direct contact. And that still holds true. We still know that skin-to-skin contact, especially between someone who has lesions and someone who doesn't and who is susceptible, can favor transmission. However, there's emerging evidence that is suggesting that potentially sexual transmission in the traditional sense, which is transmission during fluids that happen during sex, such as semen, can be supporting transmission. And that's very much a hypothesis that's being commented in the scientific community, and there's responsive research that is being executed to answer those questions. For example, there's been recently a paper that is publicly available from Italy documenting isolation of the virus in samples of semen from people with the infection. And this has also been documented in studies in Germany. So definitely we're trying to garner evidence as we go, as we respond, but it might be that a component of true sexual transmission is contributing to the way this outbreak is being transmitted. But that's still under investigation.
And I think it's really important we reiterate that we still do not know. And I know some of the reporting that I saw a couple of days ago about the semen issue in Italy from a very, very small handful of men was being reported as absolute evidence that there was enough monkeypox virus and semen for it to be transmitted in that way. And let's clarify that is not what we currently know. And as you say, there is a lot more research happening. I know I've been looking at research, commenting on research papers in the last week that is helping us to understand the situation more and more. So to clarify, there is not yet sufficient evidence for us to know if or that monkeypox can be transmitted in semen. We do not yet know that, and that might change. Evidence on that, if we come back in 2 weeks' time, we might be saying we might be jumping off the fence one way or another I think we're probably going to be sitting on the fence for that one for a little bit longer.
Yeah. It's really difficult to prove that something is not true, right? The amount of research you need to do to say monkeypox cannot be sexually transmitted is larger than just the sentence I just said, right? So I think we have evidence that it could, and we're doing more research to understand that gap. But in the absence of evidence, what we can do is take precautions.
So again, I know I asked you to clarify this point last time we were in this, did the event together, but let's clarify again the issues that transmission can happen during sex, but we're not calling this a sexually transmitted infection. Clarify that again for us.
That's a technicality, and I sometimes get annoyed about these technicalities, because for people who are not from a scientific side, it may seem a bit pedantic to say it's a sexually transmitted infection or just a sexually transmissible infection. The true thing is that we know it's spreading during sex, and I think that's what I want people to take forward. That we know from the information we're gathering from cases, especially with a larger amount of cases, that this is being spread during sexual activity. The exact route of transmission, which will have implications from everything from assessing the wider risks of this outbreak, but also the right prevention measures. That is specific route of transmission we know is through skin-to-skin contact, through direct contact, potentially through respiratory secretions again. But there's an additional component of sexual transmission, which is specifically in genital fluids or during the act of sex itself, that we're still clarifying.
And so I'd want to add one more thing in there, that even though we know it's being transmitted during sex, it doesn't mean to say that someone who tests positive for monkeypox, that is absolutely the way they obtained monkeypox. And I know that, again, I've been talking with some colleagues in European Centre for Disease Control over the last week, when there's been some actually quite difficult situations with the narrative talking about this being transmitted through sex, and then people are being accused of being unfaithful to their sexual partners, or all sorts of kind of quite difficult conversations happening. So again, to clarify for people who are watching this, although we think in places like London that this is being transmitted through sexual contact, there are other ways that monkeypox can be transmitted, including those ways that I've previously talked about, just rubbing up against someone for a bit of a time in a club, especially if you've got your top off and it's a little bit sweaty.
If I can add something there, I think anyone can get monkeypox, regarding of their sexual activity, their sexual orientation, their gender. We know this is an infection that has been documented many other times in contexts that are not related to sexual networks. So we don't want to reinforce the message that it's only a specific subset of people that could be at risk. Anyone can get it, and it's so important that everyone is aware, really.
Absolutely. I want to reiterate that point and underline that as well. So Matteo, let's talk symptoms. And Miguel, I know that you've got 3 questions or comments in the chat room. I'm going to come into them in just a second. Hi, Adrian, because I'm just going to pop Adrian's question into there because I want us to, Matteo, talk about if there's anything new that we know about symptoms. And what usually happens in a kind of an outbreak situation is that the more cases that are diagnosed and the more case investigation that happens, the more we start to know about some of those common symptoms. Has anything changed from 2 weeks ago? Adrian's saying sores on the penis and the bum seem to be common in this outbreak. That's absolutely what I've been seeing as well. Does that also suggest sexual transmission? But let's focus on symptoms just for a second.
Yeah. So I think it's good to remind everyone who's watching this of the symptoms of monkeypox. It usually involves a rash that actually looks like blisters or small ulcers or spots in your skin. This can be anywhere in the body, but they're usually, what we're seeing is usually around the genitals, in the perianal area, also around the mouth, the face, and sometimes in the hands as well. But they can actually be anywhere in your body. What we're seeing as well is a few people complaining of fever, actually to the point in which it's not necessarily a rare symptom. More than half the cases have been describing that they can have fever at some point during the course. Whether it happens at first or whether it happens after the lesions, that's where we're trying to see whether there is a pattern. As it has been flagged on the questions, some people have been saying that the place of the genital lesion can be associated with the mechanism for transmission. It's so common to have this anecdotal data of an individual case or patient that had, for example, oral sex and saw lesions first on the mouth. And that's the kind of things we want to answer with this responsive research, when we need to generate data and generate knowledge in a systematic way to be able to ensure that people are being given the right information. I think at this stage, we don't know for sure, but we're definitely doing the kind of research that will answer these questions in the next few weeks.
Thank you. And a quick reminder, Matteo, if someone has symptoms or think they have symptoms, if someone's watching this and they go to the bathroom afterwards and have a quick look in the mirror and see some of these symptoms that we've described, maybe they have a fever, maybe their glands are swollen, what should they do?
Mm-hmm. The key thing that you should do if you think you have symptoms of monkeypox is try to seek care. And there's different ways that you can seek care. If you have been in close contact, including sexual contact, with someone that has confirmed or suspected monkeypox infection, whether they have been diagnosed or not, the key thing we're asking you to do is to call your local sexual health clinic. On the phone, you will be assessed, and they will see that based on your symptoms and your exposure, so based on your sexual contacts and your close contact in general, they might invite you for a test. And it's really important that you call beforehand, because since you could be infectious with monkeypox, if you do have the infection, we want to avoid you exposing people on the way to the sexual health clinic. So there's a professional on the phone that can help you assess and answer your questions. If you have symptoms like a rash with blisters as described, but you have not been in close contact with someone that you think might have monkeypox, or you have not recently traveled to countries, for example, in Central Africa or West Africa, or whether you think your exposure risk is low, in those cases, we're suggesting people call first the NHS 111, where you will also be assessed. And based on that, they might say, okay, actually call your sexual health service. Oh, no, you don't need to worry. This is not something that sounds like monkeypox. So this is the system we have set up that people can navigate based on how they perceive their risk and their symptoms.
And having watched that system kind of be set up and be stress tested over the last couple of weeks, I'm really impressed of how that's all come together. Lots of different agencies and parts of the NHS and local authorities all working together to kind of make sure that system is as efficient as possible. So Matteo, I'm going to kind of go slightly off script for just a second, because we are getting lots of great comments and questions in the chat box. Which is, if you are watching this and you're not seeing them, these are questions that are being asked either on YouTube or on Facebook. And I actually want to go to this this question from Miguel, because actually I think this is something we were going to talk about in just a second, which is about hospitalizations or deaths. And actually we're seeing in this outbreak, I don't think we have seen any deaths so far. And the issue of hospitalizations, I know from a London outbreak meeting I was at the end of last week, just before the bank holiday weekend, what we were hearing there is it does seem that most of the hospitalizations are happening from people who are diagnosed in clinic and then are going home and are getting secondary infections in things like lesions. Matteo, is that right? Is that what you're picking up on as well?
That's absolutely right. I would love to have a number and say 10%, 5%, 20%. We don't have that number yet. But similar to you, what we've been hearing is people with infections on their skin that are secondary or put over the lesion of monkeypox. And this is because since the lesions can last a few weeks, sometimes a couple of weeks, and they can be like open sores after the blister pops, it's really easy for some bacteria that is commonly around the skin to fall there. And then if you're not washing them properly with mild soap and water, you can get a secondary bacterial infection. So the lesions are going to look red and swollen. They might either itch or hurt a little bit. And if that happens, you might or might not need antibiotics just to cure that specific infection. So in some cases, in a few cases, we're seeing reports of people being hospitalized to receive antibiotics to make sure that they're okay. But most cases are mild. Most cases we're hearing are mild. They can be managed at home. People are okay. But we're asking people to keep on coming to get tested so that they can receive the right case management.
And I'm trying to listen to you and look at the questions coming in, because I can't find the question now. I'm sorry, but keep those questions coming through. I think there was an early question about someone asking around kind of marks on the face if they got monkeypox. Is this something that we're seeing quite commonly? Are we seeing this at all?
We have been seeing people with lesions on the face, on the hands, penis, genitals, perianal area. So yes, definitely, the lesions can be anywhere in your body, really.
Yeah. And if someone has a lesion on their face, so I know that when I was a kid and I had chickenpox and I picked at my scabs, and I still have, you know, scars on different parts of my body from when I had chickenpox. Someone has monkeypox lesions on parts of their body. Would we expect someone to kind of have scarring that lasted?
I think we know that skin diseases are really complicated because people get really anxious about how their skin might look like after the infection is gone. But I think the key message here would be that if you have lesions in your face, anywhere in your body, try not to scratch them. Try not to take the scar
Scab.
the scab off. Try not to scratch them, because that can actually lead to secondary bacterial infection. And scarring is usually worse when you have that secondary bacterial infection because of the inflammation and the way the body will heal. So what you really want to avoid is getting an infection on your lesions. If you take good care of them, it's likely that you will not have any scars or complications.
Yeah, you know, as someone who grew up with acne, boy, it's hard not to squeeze those spots and pick at them. Sorry if that's too much information. Quick, hi, Roger. It's great to have you here. And I know you're asking lots of questions or making lots of comments. Thanks, Roger. And Roger just also wants to point out from the studies that come from African cases of monkeypox, the fatality rates were kind of looking at around 1%, and they're often related to other issues around immune suppression or lack of access to medical facilities and other issues. I've just found the question about scabs and things. There we go. I want to ask just also to get us to focus a bit on this is a big question that we're getting at the Love Tank. People who've been previously vaccinated for smallpox. I think I said last time I was one of just in the age group was should have been in the last cohort for monkeypox vaccines, smallpox vaccines in the UK, but I didn't get it because I had eczema. But one of the questions we're getting from lots of particularly older people who did get smallpox vaccine is this protective from monkeypox?
So there's a few things to consider here. First is that not everyone in London and not everyone that is being part of this outbreak is born in the UK, because we know this is a mixed population and they come from many different countries where the health policies at the time were very different. So it's not as easy as just comparing the age group. But even if we did so, we know that people who were born in 1975 are in their mid-40s, late 40s now. And when we look at the age group that is being affected in this outbreak, and we have publicly available data on the EP reports we've given with the age brackets, it's people who, they can be of any age really, but it's usually between the 20s and 40s with a median around the 30s to late 30s. So most of the cases will be of those younger age groups. And that's also because of the behaviors and the activities that usually occur in people within these age groups. That's not to say that we're not seeing cases in people who are a bit older or in people who might have been vaccinated. But I think an in-depth analysis of that is still ongoing. But it's definitely something we're looking into, because we know that the vaccine that was used for smallpox eradication worldwide is very similar and has a cross reaction with the vaccine that we would use now for monkeypox control.
Thank you, Matteo. And Adrian Kelly reminds us that you tell to kids with chickenpox, pat, don't scratch. Great for us to remember. Pat, don't scratch. Thank you for that useful insight, Adrian. So Matteo, kind of back to the direction of where we were going to go. I was in a meeting yesterday when we started talking about the possibility of home testing or self-testing for monkeypox. We were all used to doing that with COVID, with lateral flow tests. Many many queer people and other people as well are used to doing HIV and STI testing at home. Sexual Health London is the test kit. SHL.UK is the test kit that I frequently use, as do many other Londoners. So we're kind of used to doing this kind of testing at home. Is there a potential, do you think, that we would see the ability to self-test for monkeypox in the near future?
I think the first thing to say here is that self-tests, home-based tests are a great option for people who might not want to go in person to the clinic for whatever reason, for convenience, or because they feel at risk of going to the clinic where we're supporting a monkeypox care. And it can also support sexual health services so that they can focus their resources on the people who are coming forward with monkeypox, and you can have your regular STI screens at home. So it's great that we have that in place. The thing is that when you're trying to implement a home-based test or a self-test, you need to think about considerations with test validity. It's a very technical term, but things like specificity, sensitivity, asking people how to take the sample, make sure that this is being done the right way. In the case of monkeypox, because many of the PCRs of the tests are done with a skin lesion, there needs to be a little procedure of de-roofing or taking the scab of the wound to make sure that the sample is taken right. And sometimes it's really difficult to give the right direction so that someone can do that at home. So I think at this stage, that's not something that will be happening in the foreseeable future. We're still very much asking people that if they have symptoms, they go to their local sexual health clinic, calling first.
Great, thank you. And it would be lovely to see in the chat if that technology became available. Was that something that you would welcome? Would you think if it was reliable, if you were given good instructions about how to pick at those, probably shouldn't be saying to people that pick at scabs after what Adrian just said about pat, don't scratch. But if that technology became available, is this something that would be acceptable that you would want to use? Jessica has just joined us. Hi, Jessica. It's great to see you. Yes, as Jamie has said, this is being recorded. You'll be able to watch the first part on both Facebook and YouTube. And just a reminder of something that we said at the very beginning. Please be aware that this is a publicly available forum and that comments you make may be read or used by the media. So please be aware of that. And if you are joining us partway through as a result of an excerpt of this that has been used by the UK press in the coming days, we do invite you to watch the whole of today's event so you can find out exactly what we said rather than the snippets that make those nice juicy headlines. So Matteo, the question that's being asked in the chat, it's the question that I'm being asked all week. So Ni, hi, would it be feasible for gay bi men to get vaccinated? We know right now that some NHS frontline staff are being offered a vaccine. It's the smallpox vaccine that will offer protection against monkeypox. We also know that currently if someone is a close contact of someone who's been diagnosed with monkeypox, in some situations they will be assessed and possibly offered a vaccine. Are we able to say anything about what's thought about vaccination more widely?
I think there's a huge opportunity here because gay and bisexual men have really fantastic relationships with sexual health services, and they come in high numbers to get vaccinated for hepatitis A, for hepatitis V, for HPV. So there is definitely a precedent for vaccines being delivered to this population in this setting. And I think that is a huge opportunity. At the moment, the vaccine, which is the same vaccine that was used, very similar vaccine that was used to control to control smallpox, that same vaccine is being used to control chains of transmission in very discrete scenarios, in very specific scenarios, such as for pre-exposure prophylaxis or post-exposure prophylaxis in some cases.
Okay. Whoops, you're dropping your water there, you're bashing it over. And Matteo, you'll know that there have also been conversations about the acceptability of vaccination programs. I know we've just been through this process with COVID where there were lots of people who did not want to be vaccinated. So I did a poll on Twitter yesterday or the day before that asked UK-based gay and bisexual men if a vaccination that protected you against monkeypox was offered, would you be likely to take it up? And there were three options. It was yes, tell me where to go. No, I wouldn't. Or maybe, but I want to know more. And 70% of the about 700 people who responded to that Twitter poll said that yes, they would take up vaccination should it be offered. About 10% said no, and the remaining 20% who were maybes. When I asked people to comment or people contacted me, the main reason for maybe was that people were asking those questions about previous smallpox vaccine. So I want to know if I'm already protected. I wouldn't want to think about vaccination unless I'd had these questions answered, which is, great questions to ask. But I think, I think the headline for us to take away from right now is that, vaccines may offer some protection to some people. And right now they're being, the vaccine stock that's available in the UK is quite rightly being targeted at NHS, frontline NHS staff who need to be protected because they're coming into contact with lots of people, places like sexual health clinics.
Great. Will, I'm going to be really candid here and tell you that I need to plug in my laptop.
Plug in your laptop. Let's give Matteo a quick second.
Really sorry, everyone.
Go plug in your laptop. Don't go away. So hi, folks. So this is the chance when you can also ask those questions. But actually, as Matteo has left us for a second, I'm also going to talk about one of the other things that we've been doing collectively and collaboratively with the partnership, the GMI partnership, and with Do It London across the last week. So we've been doing work with gay venues in London, with club promoters, with sex on premises venues, and we've produced a set of guidance that is being given out and distributed to those venues across the whole of London. If you want to see them, you can go to queerhealth.info/monkeypox, where you'll be able to look at that guidance. If you are listening in this evening and you are a gay venue, or if you are the owner of a sex on premises venue, somewhere like a sauna, there is guidance there that helps you to understand what else you can be doing. And the headline from that is pretty much business as usual, but we are encouraging places where sex is happening to do additional spot cleaning, particularly on places like tables or benches, places where skin might rub up, including, of course, I made sure that glory holes were included within that guidance. Matteo, it's so nice to have you back. I'm aware that we've been going for 40 minutes. I know it's been a really long day for both of us. So as we head towards the end, Matteo, I know that in both of our social networks, we've started to know we have friends, colleagues, who are being diagnosed with monkeypox. What kind of issues are we starting to hear about from those people who are being diagnosed? What are you hearing from the people that you know? And I'm not talking about confidential professional contacts. I'm talking about the people in your networks.
I think what I'm hearing is that, and this is very much from my personal experience of talking to people, is that there is a lot of anxiety attached to infections after COVID-19, and there's also a lot of worry that this might dampen the mood of the Pride season. And I think it's unfortunate that this situation is happening right now, but I think it's fortunate that we have the systems in place available to respond to it. And I think the conversations I'm having usually end up on an optimistic note. So I want to stay with that.
I also am having really optimistic conversations with people. And as I know that we said at the beginning of last time, that we said, why should we be worried about this? And we wanted to make sure that this was contextualized, that whilst monkeypox isn't something that's necessarily very pleasant to have, and Jamie has just put up in there that about issues around stigma. Definitely seeing quite a lot of stigmatization and people not necessarily having a good time with flatmates or housemates or work colleagues. There's a lot of misinformation being put out there. But also I want us to remind people that if you are diagnosed with monkeypox, for most people it is a mild infection. Do encourage people to, if you are diagnosed, to stay in touch with your clinic. I know lots of the clinics are providing daily or every other day a phone call, a welfare phone call, and check in. And it's also important. There's again conversations that I've been having with people in local authorities are looking to make sure that care packages are started to be put in place. So if someone has had to take time off work or can't go out and do their shopping, or these kind of things that we saw with COVID care, these kind of processes are being put into place. So Matteo, I just want to make sure that we deal with this question. Miguel is asking us, is there any suggestion that an HIV PrEP may protect from monkeypox infection or make symptoms milder? Exactly the same question we got asked at the beginning of COVID. Do you want to take that one?
I think there's no evidence to answer that question. At the time, we know that the virus that causes monkeypox and the virus that causes HIV are very different from one another. And the medications used for HIV PrEP are the same medications that are used in a different combination to treat active HIV infection. So there are different viruses and these are different medication. There could be an option. I think that would require a lot more research and exploration. That's definitely something that would be captured as part of this responsive research that is being done in collaboration with the academia, universities, and several health agencies across the UK and even in a wider global network. But I think at this stage, we don't have evidence to affirm that.
So headline being that keep taking that HIV PrEP to protect you from HIV acquisition, but don't take it because you think it might prevent monkeypox. More information needed. I want to just do a quick shout out. Hi, Richard from North Wales. It's great to see you here on the call. On the webinar, and Richard, you make a really nice point there about the potential for kind of postal testing for monkeypox and testing at home, that it would improve self-isolation instead of having to physically go to a clinic. But you also make the case that because this is a virus that hasn't generally been seen in places like the UK, it's helpful for clinicians to see symptoms face to face. And I don't know if he is on the call, but this is the point when I also need to remember that my friend and colleague Monty is trying to start building up a repository of images that can be shared globally, so that kind of frontline clinicians can start to see a nice library of photos that illustrate the symptoms that we're seeing and being diagnosed in clinic at the moment. So Matteo, just as we come to the climax of tonight's event, I want us to just kind of deal with this issue that I know that we've been talking about today and in the last week about should people be doing things to change their behavior? Are there things that we can be doing as individuals or within the people that we might be in close contact with, our sexual partners, our sexual networks, to start minimizing the risk of both picking up and passing on monkeypox?
I think what we want is for people to be equipped with the right information so that they can make decisions that affect their health and the health of others. I think at this stage, we're not asking people to change their individual behavior. I think it will be a personal choice whether people decide to have less sexual contacts or to stop having sex whatsoever, if that's what they would like to do. But that's not necessarily what we're asking. We know monkeypox can be transmitted through many other ways other than sexual contact. So it wouldn't be a comprehensive intervention to implement. What we are asking people, though, is that when possible, they try to get contact details from their sexual partners. And I know in gay and bisexual sexual networks, it's usually common to have anonymous sexual partners. So it's a bit of a change in culture, maybe. So when possible, getting contact details from someone you met on Grindr, met at a sex club or a sauna would be good in case you need to be called back, because maybe that person could be diagnosed with monkeypox in a few weeks, but maybe you'll have to provide details in case they need to be called back. So it's about taking care of your health and taking care of the other person's health as well, to share those details. So in case there needed to be an element of contact tracing, that can be facilitated. It's also a way of protecting yourself.
Thank you. Matteo, last few minutes, is there anything else that you want to make sure that we get across before we finish tonight's event?
I think it's just a big thank you, really. Thank you to the people who are engaging, the people who are connected, who are asking questions, who are making sure that their health and the health of others is taken care of. What about yourself?
The same thing. I know of a lot of colleagues who are working particularly on the front line of the NHS, particularly people in sexual health clinics. I also want to say Lauren and colleagues at LGBT Foundation and on the call tonight. There are lots of people from our community-based organizations, our voluntary sector organizations, my colleagues and team at the GMI partnership who are out at festivals across the weekend and in bars and clubs and saunas. So many people are working really, really hard on top of everything else to really keep us and our communities thriving and alive. And so I want to add to that massive thanks to all of those people who are really out there. I want to thank all of you for joining us again tonight. It was a really good turnout again. We would love to hear from you through our social media. You can contact us both at the Love Tank or Prepster. And if you have any questions, please send them through our social media again. And we would love to hear from you if it's useful for Matteo or I or any other people to join us in a couple of weeks' time, if it would be useful to have another one of these sessions. Thank you all so much for joining us tonight. It's always lovely to do these events. Look after yourselves, look after the people you're around. Keep looking out for information about monkeypox, and have a great, safe evening. See you soon.
Thank you, everyone.